Okay, so welcome to the Town of Northborough's Board of Health monthly meeting. Today is May 10th, 2022, and time is 6:02 p.m. So let's do a quick roll call here. Dilip Jain is present and acting as chair for Glenn French. Teresa?
Present.
Lisa Johnson?
Here.
Isabella Caruso?
Here.
Okay, Kristen Black?
Present.
And Katie Holt?
Present.
Do you have to do your public meeting thing?
I know you all want to hear this again. So here we go. We'll see how fast I can go. This open meeting of the Northborough Board of Health is being conducted remotely consistent with Governor Baker's executive order of June 16, 2021, and act relative to extending certain COVID-19 measures adopted during the state of emergency. All members of the Northborough Board of Health are allowed and encouraged to participate remotely. The order allows the Northborough Board of Health to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. Members of the public who wish to view the live stream of this meeting may do so by going to Northborough Remote Meetings on YouTube via the link listed on the agenda. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting, or a few agenda items in particular, will feature public comment, particularly agenda items number 3, 4, and 5. And that is all. Thank you. Okay.
So we need to go, I don't have the agenda opened up here yet, so that's like I'm looking for it through all the emails.
I can walk you through if it's easier. I've got split screens here.
Oh, that'd be great.
Okay, so Dilip, our first item on the agenda is our COVID-19 update. We noted case counts, contact tracing, and testing, and Isabella Caruso is prepared to speak to that, as well as roll into agenda item number 2, which is a community health assessment discussion. So hopefully Isabella is okay to share and take on over.
Yes. All right. Present. All right, can everyone see this? All right,
yes.
Perfect. So my name is Isabella. I'm the regional epidemiologist working with the town of Northborough. So just to get started, COVID cases have definitely increased since we last spoke last month. So in the last 2 weeks, so this was recent as of 4:30, there were 73 new cases for the 2-week period in Northborough. The 14-day incident rate was 38.4 compared to 32.5 for Massachusetts. So a little bit increased from Massachusetts. And the percent positivity rate was 7.7 compared to 5.11. So definitely increased trend-wise and also compared to Massachusetts. And the last 2 weeks, which is the newest dashboard that will be posted on Friday, we've had 81 new cases. So just slightly up, 8 more cases in the last 2-week period. The incident rate and percent positivity rate will also be posted on Friday with the dashboard. And then this is kind of the entire pandemic we see over here, that we are seeing a little bit of an increase from where we were at in early March. But not too bad yet, hopefully. And then wastewater data. So we spoke about a month ago, it was actually 412. So we were around about 500 to 600 RNA copies per milliliter, and now we're upwards of 800. So definitely seeing an increase in wastewater. This data specifically is from the Southern Metro, the MWRA, which doesn't quite cover Northborough, but it covers Framingham and Ashland, which is as west as it gets. So a pretty good indicator of trends that we might see in the future. And this is important because it's not dependent on test availability, PCR reporting, anything like that. So it's really just testing the water. And importantly, update from last week, the CDC community levels for Worcester has actually now been posted as high, which a few other counties in Massachusetts, as you can see in this map to the right. So Middlesex is also high, and then other counties in Western Mass. So high, basically for the CDC, it means that people should be wearing masks in public transportation and transport, and also a recommendation to stay up to date on COVID vaccines, getting tested, kind of everything that we should be doing anyways, but just a reminder that cases are high, community transmission is also high. So this is just an update for that. And just a reminder that we are still doing contact tracing. So if you do test positive and we get access through Maven, we will try to give you a call just to give you the most up-to-date isolation guidance. Also, free PCR testing is still available through Stop the Spread, specifically Worcester and Framingham, which is close to us. USPS, you can still get two kits, 4 tests through USPS, so you can order through that link. And lastly, Northborough, we have some test kits, so you can pick them up at Town Hall, the library, or the senior center. We really do want people to be testing, especially with these allergy-like symptoms. And new news that came out just last week, there is a new telehealth COVID-19 program in Massachusetts. So it is available for any individuals 18 or older in Mass who have tested positive and are experiencing symptoms. So a new treatment, relatively new treatment, is an antiviral pill. And it's the best, basically, if you take it within 5 days of your symptoms, it reduces hospitalizations and severe illness by about 90%. So basically, this program is allowing people who don't have health insurance or a primary care doctor just an easy way to access this treatment. And the services will be provided in multiple different languages, and the services are supposed to be done very quickly, and then you can get the treatment as soon as the next day. So this is new, and more information can be found at mass.gov/COVID telehealth. Right. So any questions about COVID cases or updates before I get into the community health assessment? No? Okay. All right, perfect. So community health assessment, this is something the department has been looking into, and I just really wanted to open a discussion about what it is, what's the value, and what do we see, how can we see us doing this moving forward? So the CDC describes it as a health assessment that identifies key health needs and issues through comprehensive data collection and analysis. So a lot of towns, hospitals, states do this. It's a great way to identify these problem areas in specific towns, cities, regions. And there are namely 8 critical steps of this. The first is to organize and plan for an assessment, which is really identifying and engaging key stakeholders. So whether that be people of the health department, schools, police department, youth and services, things like that. And then secondly, engaging the community, because this is where all of the information will be coming from, the primary data collection. So the third, typically people will gather together and kind of make a committee for this community health assessment, and they will be leading the efforts. And then for conducting the community health assessment, which can take anywhere from a few months to almost like 9 or 10 months. It's a really big project, which includes primary data collection, so focus groups, interviews with key stakeholders, community meetings, things like that, to get input on the town, health issues, all different topics like that, as well as secondary data. So census data, any survey data that has been conducted in the past, so like the youth risk behavior survey and other surveys like that. And then after the results are in, people will meet and they will prioritize the health issues. So what did they find? What is the most important areas that we need to cover? And this will go into development of a community health improvement plan, which is really the importance of doing the assessment. So what can we do now that we have this information? And then after that, it's implementing and monitoring the plan and evaluating the process, and outcomes. So it's a pretty long process, but it is incredibly valuable, which goes into the next slide. So as we know, we've been talking about COVID for almost over 2 years. So it's highlighted many health-related concerns, issues that our residents are experiencing. So we think now would be a great opportunity to identify these areas and really ask residents to comment about their experiences. And this will better inform how we can support our residents and community. In addition, the outcomes of the community health assessment will allow us to seek and apply to different grants and resources, again, to further meet our community needs where they are. And lastly, the American Rescue Plan Act, so ARPA funds can be used to conduct this as well. This is not a very inexpensive project. It is, long, cumbersome, and usually people will hire a third-party vendor, so a public health consulting firm, to conduct this. So this is one way that we could help pay for it. We would also look for additional grant funding opportunities. So Kristen, I don't know if you want to add anything else. Just maybe open the floor up for any discussion and maybe what other people think about this project moving forward.
Yeah, great job, Isabella. Thanks for pulling that together. I think, we're all coming out of COVID as health departments in our Greater Boroughs Partnership for Health, and everyone's saying, well, what's that next step, right? What are our lessons learned? What are really the needs of our community? I think one thing we heard in the town of Northborough with the ARPA funds is, what are we doing? Our seniors are isolated, our children are dealing with, depression and, the rates in the YRBS through Metro West, self-harm is up. Depression is up. We're seeing trends in the middle school. So I just think, we have a fabulous community in Northborough, and we really want to think about, what do we as a Board of Health want to do? Where do we focus our efforts? I think these are very valuable, right? Most of the time, a small community like Northborough doesn't always have the opportunity to do these sort of assessments, either based off financial reasons, staff, leadership, but, we are in a unique position of having public health funding at this time, most importantly, having staff, having Isabella to have the time to say, do some research, Isabella, like what are other communities doing? Would there be a benefit if Northborough, Southborough, Westborough, and Boylston joined together with maybe contracting with one firm with a maybe customized, community health assessment for each of the towns, but there might be some cost savings or greater value in a larger assessment, being a larger geographical area. So we're really just brainstorming. Like, this discussion is in its infancy. We've never presented it to the Board of Health. I'm curious, Dilip, if the Board of Health has ever discussed this in the past, and, where do we want to go? I would just say, I'd preface it, this is at its infancy. I think Isabella is going to make the same presentation to at least, I think, 3 or 4 of the boards, right? So in the next month or so, to sort of say, hey, Westboro, what are your thoughts on this? And so Isabella did a little research and made some phone calls about other boards of health that are started this process, and procurement, and vendors that would be suitable, and to talk more through it. So we just really want to open it. And Isabella, as I was listening and pulling up some other screens, so that it is a big ticket item for an individual community like Northborough. We're talking upwards of 50,000 or more. Obviously something at that number for a town like ours, we'd have to go through the procurement process. So it's not, oh, we have that money sitting in an account. Like, no, I think it's, one, we're gauging your interest as a Board of Health. Do you find this valuable? If you do, our next steps would be, how would we fund it? And there's a whole number of ways to do that. Metro West Health Foundation last did, it wasn't the Health Foundation, it was the local hospitals did a health assessment, but it's older, and I think there were only, Isabella, what was the percentage of Northborough residents?
It was published in 2019, and out of everyone, it was only 1% Northborough. So it's great that we're included, but again, that data is not super helpful to us to identify priority areas, because it's just such a small little portion of the whole assessment.
Yeah. So we talked to, conversations with DPH. So, there's a lot more work to go, but I guess the first step is, this is really would be Board of Health driven, or something you find valuable. So we're happy to answer any questions or hear what you all have to think about this idea.
Well, I think it's going to be a very helpful thing to assess the health. I know one of the meetings I had mentioned previously about assessing mental health in school kids. Now, whether we do that through simple questionnaires that, they're old enough to answer the questions, they understand what the questions mean. And then follow it up 6 months later, 3 to 6 months later, see, okay, which way are we headed? Are the scores getting worse? Are they getting better? Especially if, COVID raises its head again, and now they all have to go back into masking and, controlling that. Another thing is, and I know we talk mainly about the residents here, but is there any benefit to assessing the needs of our businesses in this whole scheme? Because I know everything that Isabella talked about was about residents and people in the community, but do we need to take into account businesses who, they employ a lot of the people in town, they service our residents. And I'm just wondering whether that's another outreach, because you may find, not that, we're going to give them money to do anything. It's not the PPE stuff, but, they may have some unique needs that they may need help with. And I don't even know where to begin on that one, other than that is the other part of our community, right? How to support them during this, because they've lost business. I mean, let's face it. But we're not here to support them financially, but is there anything from a health standpoint that we can help them, whether they need education, constant updating on guidelines, the numbers, they can access it, but maybe we need to be proactive and say, okay, numbers are going up. This is something we need to think about, et cetera, et cetera. So just food for thought.
May I?
Yes, Teresa.
Thanks. I think this is a great idea. For a number of reasons. I do think it's important that we know, how our general population is really doing right now. And I don't think anybody is doing the same that they were doing 2 years ago. There's probably a small percentage that's doing fantastic, but I think overall, we all have a little extra that we wish we didn't have. The question that I have is, so we go through the very important exercise of determining the overall health of this community. What do we do with that data? I mean, I have 2 teenage daughters, and I can tell you they are not the same kids that they were 2 years ago. And there are people who could use services that don't have services or access to services. Does the accumulation of this data enable the town to tap into other resources that we may be able to provide to those people who need them? And that's really, I would love to see this done so we could advocate for additional services for those people who need them.
Yeah, I mean, I'm sure obviously the schools have psychologists, if that's an option. So, to direct resources towards, making sure the kids get access to that. Of course, seniors, somehow we have to be, because I can see a lot of kids and we haven't even felt probably the full brunt of it yet. What it's going to mean, especially if this drags on further and further for whatever reason, and these are going to be the productive members of society. And if they're not productive, the whole society is going to go to pot. It's just the way it is, So we have to make sure we, intervene quickly, early intervention, as early as we can do it, being all safe and all that, and to provide as many services, resources we can, the town can afford to do. And, most of these people will have access to those services, to their own health insurance, to their own primary care doctor, to the pediatrician. So they will have access to that. It's just making them aware. I mean, part of it is that, right? I mean, kids get seen by their doctor once a year, for their annual exam. And, I'm not sure how much time is dealt on mental health issues. Although they're supposed to get tested for depression and anxiety, but, who knows how often and how meticulous that happens. That's the only issue.
Right. Well, is the testing done, for example, the testing within the school system, would it be done anonymously?
Well, again, my perspective is that it can be done anonymously, but then if you don't know who it is that's showing symptoms of depression or anxiety, how are you going to address it then?
Right. And that I absolutely understand. That was the reason for my question. I think, part of what you still get a lot of that shame factor when it comes to mental health issues, and, people don't own up to it. And
Yeah,
we may see it as parents or as educators or as caregivers in some other level. We may see it. But, we've got to also encourage our kids to be honest about it as well. And
yeah,
I don't know, as Kristen said, this is still the very beginning, the very first conversation we're having. And I guess if there's a way to sort of tailor this to really bring out it's okay to not be okay,
yeah.
that might be a better way to get to those
May I
real.
interject? May I, Mr. Chair?
Yes, Lisa.
So first of all, I just want to thank Isabella for starting this process, and I'm really excited that we're going to assess our community. COVID's a perfect opportunity to really think about what we're not aware of as a community. I just want to mention, from my perspective, when I put my public health hat on, we can't be all things to all people, but we can bring awareness. You both mentioned the importance of awareness, and many people in the community aren't sure how to have those conversations, to have meaningful conversations around mental health and how to access health. So while we might not necessarily have services for all, we can channel individuals to where the resources are, but we don't have those numbers. And with the community health assessment, my understanding, Kristen and Isabella, if you know more about this, please chime in. We don't have the ability to really do a study as to, take a snapshot today and evaluate it in 6 months. We're pretty much collecting this data and then organizing it the best we can as a community. And in a perfect world, we do it again in maybe 5 or 10 years. So, all these ideas are really great. And as we pull in the stakeholders in the community, Dilip, you mentioned the businesses. That would be a great opportunity for them to say, how is it impacting them? How are their staff and their customers coming in? And how are they perceiving the health issues? And then as far as the students that, are suffering so much from all these changes with their academic journey, that's a tough one, because schools have their hands full. So how can we as a community bring more awareness? Maybe that's the place where we want to bring more education for families and some sort of support groups. Still brainstorming, finding out what other communities may be doing. But yeah, so I'm wondering, to that point, when we do the community health assessment, assuming that we'll move forward with this, I can't recall what role the schools play in this, because I know that they're usually canvassed and questions go out to them, but I don't think students necessarily are asked questions. It would come from perhaps the school psychologist, the special ed groups, perhaps the principal. So does anybody know how that typically functions in a community health assessment?
I just want to, I'll let Isabella talk about, I think it's the nice thing about community health assessment is you can really adapt it to your community, right? So there's some groups that just run it, and we're so robust, we're a city, it's the health department is going to put this on. There's other groups that form a working group, a community health assessment with key stakeholders. I mean, we could say to the third party vendor, yes, we have a youth risk behavior survey, but we want you to do, proctor Q&As with students, and can we get students who, so I think it can be, and correct me if I'm wrong, Isabel, really whatever we want it to be. I think, based off of the YRBS data from Metro West, I'm particularly interested in targeting those middle schoolers, which are seeing really big uptick. So how would we work with our schools and our families to create a safe setting where maybe the students would be open, to discuss some of their concerns, either through additional survey questions, individually, through a parent-student, proctored discussion forum, something particularly focus groups at the schools, held with the school psychologist. I think there's a lot of ways we could get at it. And most importantly, we want to do it in a way that the schools are in agreement. Parents that feel safe, the kids feel valued, the kids feel heard. So I think there's no question a major component as we would write the scope of this would be a focus on mental health, in particular, students, starting at those younger ages. So I think it can be customized. I think there's a lot of different ways to do it, but I'll turn it to you, Isabella. I don't know if you have anything to add to that.
No, I think you said it perfectly. When I spoke to one of the consulting firms just to get an idea of what we could do, it was definitely she kind of threw it back at me like, what do you want to do? So it's definitely, after we come up with more ideas and, secure funding and talk about this more, definitely figuring out what focus groups we want, what people do we want to target. I think business owners is a great idea. Schools would definitely have some stake in this, whether it be like churches and religion groups, or really you could go so many places. Different languages, different like immigrant status, really whatever population you want more data from. This is one way to do it. And then that's the consulting firm really works on community engagement, as will we with the community stakeholders, but that's also their role.
Yeah, maybe the other another option would be to utilize the parents, parents of middle schoolers, and have the questionnaires and things go out to them so they can help, so they can be made aware of what's going on with their own children, right? It's fine to have the schools be aware of it, but maybe the parents should be aware of what's going on with their kids. That, oh my God, maybe we need to have some intervention by our primary care doctor. So, I don't want to put it completely on the schools because they have enough stuff going on. But maybe this is a way to corral the parents into saying, okay, we have some issues here going on with your student. And maybe we need to get them some help, whether it's through your own, resources, primary care doctor, your psychologist, whoever you want to take them to, or, the resources that the town has available at school. But I think getting the parents involved is, I think, going to be a big part of this whole key. So whether the questionnaire goes out through the school to the parents at home, to have them work with their kids on the questionnaire so they can fill out, get an honest opinion. And they may be less afraid of saying something in front of their parents than saying it at school when you have 30 kids filling out the same questionnaire. Yeah, I don't know, just my thoughts.
And I will just add, we're not ready. We don't have all of the data yet, but the youth risk behavior survey, I think that will be really helpful
Yep.
once we can finally present that data. We've seen like little snippets, and they're definitely a lot of downward trends, which is upsetting, or I guess
Yes,
increased, more
sad.
negative trends.
Yeah, that's sad.
But this is the first year that it was actually done completely remote, like on a computer. So that also might have helped. People might feel more comfortable, like just clicking a box on a computer than writing it down. So I do think that data will also help us. Kristen and I have talked about like different grants and different things like that. Once we see the data and can really, speak to that, that will also help.
Oh, that's good. That'll be great. That'll be great. Thank you for sharing that. Yep. Any other discussion on these 2 points on COVID or community health assessment? Anybody else?
I just wanted to add, so we're also seeing, we want to find areas, I think it's already touched upon where we are lacking resources, or where we want to invest in our local public health moving forward, or the overall health of our community. And I think as the state of Massachusetts has been reinvesting in these shared public health regions, it's a great time to reflect and to say, what are we missing? What do others have? And really, how do we build our community better, and support, our health services or overall community health? So I would just say, I guess with like a nod, we don't need to do any formal votes, but I just overall, where I'd like to get back from the board is a consensus. Is this something we'd like to investigate further? My thought would be that we'd see where the other boards of health come in, sort of come at this with the 3, 4 to health directors, set up meetings with DPH, with Metro West Health Foundation, to say, this is something we want to do, DPH, Metro West, any other, opportunities that we could have to help support this with funding. And, ARPA to me would be not our last resort, but there's a lot of different pots of money. I think the way we're trying to fund a lot of these public health initiatives is, it uses many different complementing grant sources and other things, because ARPA is a big pocket of money with a lot of people looking to do many different things. So I don't want to in any way, mislead the public. I think that's something we'd look at, but first there may be other grant opportunities. So if you're agreeable, Isabella and I are happy to work with our other partners or partner communities and try to do some networking and investigate grant opportunities and learn a little bit more about this. But, it's not something that will happen overnight. It does require procurement, and we would be coming back if we were to move forward with additional information on funding, and then really developing a scope of services that we would put out to bid with the third party.
I mean, Teresa, Lisa, I mean, I'm presume that you guys are going to say, but I don't want to speak on your behalf. I'm all for it, to move forward with this, because I think this is a unique time. The last 2.5 years, it's very unusual, and we're seeing the effects of it now. I just don't think we've hit peak yet, so.
Yep, I would agree with that as well. I'd love to see this happen. I think it would do a lot of good.
I agree also. For all the reasons.
Yep. Do we need to make a formal motion on that?
Nope.
Okay.
I think
Perfect.
you're heard. We're on it. Isabella's, here. The other update we'll cover a little bit later. I don't know, Isabella, if you're gonna stay on, but we are in the process. I'm waiting for a final approval for the state, but we're looking to make Isabella full-time. We do have additional grant monies available based off of Erin's maternity leave and just shifting some grant line items. So we're hoping with her having her summer schedule more open as a PhD student epidemiology at UMass, that we can bring her on full-time. And this would be a perfect project to help drive this process. And so that was the other thing that, could be a great catalyst. Like we finally have the staff, because this is a big investment of time and development and scope of services, a lot of revisions. So I think we have that capacity this summer. So it'd be a good time to look into it further. So
Okay.
thank you.
Good.
And thanks for the presentation. And
Yes,
I guess,
thank you.
Mr. Chair, our next item is the public hearing on 15 Settlers Road. So unless there's anything further, we're good on the community health assessment. And I just
Yes.
wanted to read that we do have posts on the agenda on item 3 is our public hearing on 15 Settlers Road at Title V plan review, request for a local variance for 25 feet property line setback for new construction. This was submitted by the owners. The representative has requested a continuation of this public hearing. I don't know if we have anyone with hands raised. 2 abutter notifications went out on this. And
Okay.
so, and on settlers. So I don't know if Jim can speak to any hands raised.
I don't currently see any hands raised, but if you raise your hand, I will do the allowed to talk.
No,
This time.
I don't think so.
no one there, Jim?
No hands at this time.
Okay.
So
It's
I think
like-
we need to make a motion to continue the public hearing
Till next month?
to next month.
Okay. So I make a motion that we continue the public hearing on 15 Settlers Road to the month of June, as requested.
Second,
All in favor? I say yes. Teresa
aye.
and Lisa.
Aye.
Moved.
So again, Mr. Chair, I'm not sure if you're staring at the agenda. But next up is Kumar's South Indian Village Cuisine, agenda item number 4, an update on the status of violation corrections. So I can provide a brief update to the board, and I understand that the owner or manager's been alerted as well. So I just want you all to think back. We last discussed this, I believe, in December. Kumar's was brought forward for certain serious code violations, and there was a corrective action plan voted on by the Board of Health that for the next 6 months, in order to stay open, that the owner or operator would within 30 days, I believe it was 30, would
Mhm.
hire a third-party food consultant
Consultant.
approved by the Board of Health to provide monthly inspections and monthly trainings, one or the same vendor. So Diane Legier, our food inspector at that time, really took the lead on this. She worked with Jason Karen at Avery Food Consultant, who might be speaking to this in a minute. And there were early actions taken and interventions. All of the board members should have received copies of those recent inspection reports. Diane was last out there, I believe, on 4/22 and 4/28 or something along those lines.
425, yeah.
4/25. There were some serious violations. There were repeat violations, and there were concerns with that, serious concerns. I did go out and do an inspection today, and you should have all received a copy of that. There were some improvements. I don't want members to read too much into the scores because if I enter the violation 3 times, the score goes down, 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 for the sake of time. I would just say, in the absence of Diane Legier to speak to this, as you know, Diane has resigned from the position. So I'll speak to it directly. I have concerns about food handling, food storage, date marking, basic temperature, hot holding processes. Warewashing machine was out of temperature, some concerns their ability to use the 3-bay. I really will turn it over to the owner and manager when we get to this point, but additional, I have concerns. I would like to see more involvement with our third party, and maybe he could speak to the training. I also would like to see a certified a manager, ServSafe manager on site at all times. At the time of my inspection, we did have an individual present who was the person in charge, but I don't have a copy of a ServSafe manager. So one possible recommendation is that clearly we have unsafe food practices or a history of it. A lot of corrections have been made, but there still is work to be done. And so I did have a Maramutha, who was present on my inspection, did mention that he had a ServSafe, but I have yet to see a certificate. So I'll turn it back to the board, and hopefully we have the manager present or the food safety consultant present with a raise of their hand in the Zoom feature that can speak to the state of Kumar's at this point.
Do we have somebody from Kumar's representative?
Yep,
Yeah.
there's a hand raised from Avery Consulting. Would you like me to bring them over?
Please. Could you please announce yourself with your name and your position, please?
Yes, how you doing? Jason
Great.
Karen with Avery Restaurant Consulting.
Great. So you've been working with Kumar since December, since the
Yes.
board mandated that?
Yes, I am.
And what have you seen that,
I've seen steady improvements, but still repeat violations. The dish area is a concern of mine. I brought it up multiple times. Training with the staff and getting the machine, up to date. He had called the company Autoclor multiple times when I was there. I don't know what the follow through is. So that is a concern. And the buffet line is a concern as well for keeping everything hot
right?
out there. So
obviously, as Kristen had mentioned, we're not going to take the scores into account.
Yeah.
The troubling issue here we have in December, we had them come into the Board of Health, and they're very agreeable, amenable, admitted that there was an issue, et cetera, et cetera. And between in December and April 22nd, there didn't seem to be like a huge improvement at all. When I look at that report, again, not taking the score into account, but the score at least gives us some projection of which direction they're headed. The score was 47, if I remember correctly, on
Yes.
April 22nd.
Yeah.
And so many repeat things from December. When I pulled up the December report, it's like they did nothing for 4 months.
right.
Okay. Then 3 days later, on April 25th, that 47 went up to 75 or something like that. And some things got cleaned out, but something still didn't get cleared out. Like, the temperature stuff, the hot and cold, the sanitization. I mean, a lot of stuff, infestation, things like that, pest.
I didn't see any infestation when I was there.
I thought on the April 22nd and 25th report, that was marked there as.
From Diane, I didn't
Yeah,
read that.
I believe
looked
it
at the-
was.
Okay.
Okay.
Oh, to clarify, Dilip, I think that point was about the screen. The door was propped open and there was a concern of the screen.
Okay.
I think it was more, preventing.
All right. And then, of course, Kristen went out today and I saw that report, and of course the score, again, I understand we don't want to focus on the score, but it did go up. So it was heading in the right direction. But the problem that I am having individually and as a physician is that it's taken them 5 months and they're still not where they need to be. And I am not sure what more, other than, what Kristen has suggested, that we can impress upon them that at some point in time, something has to give. This
Yeah.
is, and I think I can see that in your voice, in your expression, that you're also not happy where they need to be.
Right.
So that's a concern. And I don't believe there's anybody here from Kumars to explain why that hasn't happened yet.
Huh. That's
You know,
disappointing. Yeah.
So the point is, that's great. You're the consultant, you're doing what you need to do, but you can't be there 24/7. And
No.
what are they lacking?
So I don't know what they're lacking, because we have very intelligent conversations when I'm there. I go over with the chef or Dev, the manager, who bounces around, and we have great conversation, and it's, yep, no, I understand. And it's corrected on site. And then there's no follow through. So it's almost like I would have to do a 5 week in a row kind of visit.
Mm.
And what happens on week 6 if I don't go? I don't know.
How many ServSafe certified people are on site there?
He told me there was 3. I saw Dev's, the manager, the general
Okay.
managers, and the chefs.
Okay, so
I
there's
didn't
2
see
of
the
them.
third. Yeah. I did not
Okay.
see the third, but they said there were 3.
Okay. And somebody's always there that's ServSafe certified?
Every time I've been there, yes.
Okay. So despite the fact that somebody ServSafe certified is on site all the time, we're still not seeing the improvement.
Yeah.
That's concerning. I don't know. What does everybody else have to say about this? Teresa, Lisa?
I think it's extremely concerning. When I saw this report come in, I was pretty flabbergasted that we really hadn't made the improvement that I would have expected.
Mm-hmm.
It's considering how awful it was for that first one.
Yeah.
I really thought the only place you could go from here is straight up, and it went up a little bit, but it seems to be moving more sideways than up. I do have a question about the buffet area. Is there a mechanical issue that's preventing proper temperature there, or is it user error?
I think it's user error, unfortunately. I think it's the laziness of not boiling the water before it goes into bins, making sure the food is at the proper reheat temp before it goes out. I just think it's either laziness or, they have a lot of people that are working in that kitchen. And the first time I went, I had to leave. It was bad. And I came back a couple of days later. If the chef isn't there, it goes in a tailspin. And Dev was there, who's a food manager, and it was concerning. And they did improve with the underlying still a couple of things each time. So I don't know if it's laziness or lack of understanding.
Well, I think that they need to understand that laziness will end up killing somebody.
Well, no, I try to express that.
And I don't want anybody from this town or from anywhere, frankly,
You get sick. No,
to get
I agree.
as a result of somebody's just general incompetence.
Yeah.
Or apathy. I think, and I don't know what the remedy should be. I know for myself what I would want it to be, but I don't know, as a board, I have a lot of trouble sitting here saying, well, let's just let them keep doing what they're doing. Because I think it's part of our job is the oversight of these facilities to make sure that people don't get sick and they're not put in a position where that's a possibility. So
Well, maybe if a remedy would be to close that buffet until they got all their other scores up. So that would eliminate all kind of holding and everything is made to order, which is, everything is brought to kill temp at that point. And that, the rope gets tighter and tighter.
Yeah.
Do you want to just comment on today's, and it wasn't shown in the report because it wasn't a violation. I do have to say I temp checked the buffet today and all but one tray were at temp. The tray that wasn't at temp had very little in it, and it's hard when it's open because
Yeah.
the temp drops really quickly versus the other temps were at like 160, 170, at the center. So, I talked to them a little bit about, you want to stir it, you want to have somebody managing this. I think regarding the buffet, I would recommend, I didn't see a log anywhere, right? Like you should have a staff member that's temp checking, that came out of the back, but they're not in the routine of temp checking that, right? So there's certain procedures, policies, the 3-bay sink, there is no signage about what are you supposed to do? How much, sanitizer do you add? What's the temperature that you should see in the water? There's no signage at all. And so, I think, and there are multiple languages, I believe, primary languages in that kitchen, like most kitchens. All of that can be translated. That's available online. I don't know if that's something that you could help them with.
Yeah.
Jason, it's
I
just,
mean, I did it with Casa Volanta. I mean,
Yeah.
they did it and they did it very well. So,
okay.
yeah.
I mean, I'm willing to give them another week and to see, Jason, could you go out there as soon as this week and try to get?
I can probably get there Thursday.
Okay. I mean, I think the biggest, again, it's signage. I would say at a minimum, given them all of these issues, I want to see, they have to have a ServSafe manager present at all times.
Okay.
And that wasn't 100% clear today with the individual who said he had a ServSafe, but I don't have the document. Katie just researched that for me. I mean, I did this inspection at 3, but I would say, and I'm happy to talk about, we need a ServSafe manager present at all times. We want the 3-bay sink instructions, posted on the wall with all languages that are spoken in that kitchen.
Yeah.
That ware-washing machine in particular was not at temp, and that needs to be serviced. If the ware-washing is not up and running, it's not realistic that a 3-bay sink is gonna especially keep up with a buffet. So
Right.
I would say if they don't have that ware-washing ready, the buffet should be closed, because you can't keep up with the dishes to run a buffet if your ware-washing machine is not going. And so I'm happy to talk to the owner, but I think those could be some immediate changes. Close
Yeah.
the buffet until we get the machine working, ServSafe required at all times. We'd be looking to have some, checklists and temperature check logs. So we could go in, it's hard to inspect as the health department. We walk in, everybody's running around and things are moving, but what have you been doing? Like you said, Jason, you can't be there every week. But
Yeah.
is there documentation that on Tuesday, somebody
Are there
is
good
temp
habits?
checking every
Yep.
half hour on the buffet?
Yeah,
Yeah.
creating good habits, right, can go a long way to preventing bad things from happening.
Yeah.
Kristen, would your inspections, are they scheduled? Are they pre-announced?
This was not today, no.
Okay.
Yeah, I don't like to pre-announce.
I don't either.
So,
Okay, good.
So are we going to suggest that we give them a time frame to get this stuff done?
And say a week from today.
yeah.
And in the meantime, we keep the buffet open or close it down until they can start getting the
Well,
3-bay sink?
I'm gonna call Dev right when we get off the phone, the manager, and I'm
Okay.
gonna explain the situation, and I'll either be there tomorrow or I'll most likely be there Thursday. And it has to be fixed or the buffet is closed, and then, and then by Tuesday of next week, if we're not above a 90 with all these other things done, he's done.
Okay,
Yeah, I would say definitely the buffet should not be open if the ware-washing machine is not
Yep.
available. There's no way in a 3-bay sink with the layout there that you could keep up otherwise.
yes. Okay,
And so the other thing, I just want to make note to the Board of Health. So it was December, the Board of Health voted that we wanted these monthly inspections for a 6-month period. I think so that would be ending, June. I think we're going
June.
to extend that another 6 months,
Yes.
and see where it goes. So I think that's another thing we'll make Dev aware of. I mean, if the board's agreeable that we'd be looking to extend. I think we'll definitely make sure to have an update and keep this on our agenda for our next Board of Health meeting.
yes,
If that's something you would like, and at that point, we could vote that extension.
Extension.
To the board, so
I-
we'll.
well, I think that should almost be a guarantee. I can't imagine that's going away.
Yeah.
Okay.
And do we have the ServSafe certificates from the people who claim they are ServSafe certified, or we don't?
I don't have copies of them. I did see them.
Okay, for all 3 individuals?
I saw for 2, not for 3.
So we don't
So
know
I'll
if they have 3.
confirm, I'll
Okay,
confirm that.
Can we require that they submit the copies to Kristen?
Yep.
Yep.
Within the next 7 days?
yep.
My plan would be tomorrow, I think I'll miss them, but I'll be in Thursday to speak directly to the manager to relay. So we're requiring a serve safe present at all times.
Yes.
And ask for copies to be forwarded by the end of the week. Buffet closed till warewashing is available. I mean, I'll put the call in even, and make them aware
Okay.
for then. So we'll look for that serve safe manager present at all times.
Oh, thank you.
And other towns, just so you know, do have local regs that require that. Northborough, local can be stricter than, the state or federal food code. And so Northborough, we don't mandate serve safe present at all times. They can train the person in charge at that time. But in this case, we have had other towns that
You're the
just,
first town that I've, that doesn't mandate it. Other towns I've worked with have always mandated it,
yeah.
closer to the city, but.
Yeah, for some of the other ones. Yeah, because sometimes, they should have that serve safe manager present. So they have to have one, but often, they'll train others and not be present at all shifts.
Maybe that's something we need to take up when everyone's here.
Right. Because Katie, we had establishments that were permitted when we first started here. They only had food handlers. So they didn't even have an individual listed. So we've been a bit behind the times in Northborough on that. And that's something we're looking to make improvements upon.
Any other questions for Jason? Teresa, Lisa? No?
No,
All right.
thank you, Jason, for staying.
Yes.
on.
Thank you.
Thank
Thank you
you
so
very
much.
Yeah.
I think I'm next with Casa Velata as well.
Yep, so I would read our next public hearing, agenda item number 5 is that Casa Vallarta update on the status of violation corrections. So I believe you were all forwarded the most recent inspections from Diane in April, which were very satisfactory for Casa Vallarta. I have not visited there personally, as Diane told me they were doing a great job. So if it's okay with our chair, I'd hand it over to Jason to provide an update.
I'm perfectly fine with that.
They have taken the bull by the horns, and they really dug in, the general manager, the owner, the kind of the lead prep cook. Everything I've taught them, and it was funny. I was sitting there, we were going over everything. I said, these signs are great. I said, they're all in English. I'm the only English guy, English speaker here. Let's change these to Spanish. They're like, oh yeah. I'm like, yeah, look at that. And they did it, and they've done a lot of work to they had a problem with their roof above their dish machine. They fixed that. They fixed all their refrigeration, the downstairs cooler. They really pay attention to cooling. So they've done a great job, and I was very happy with them. So I think, I have 2 more visits to go, and if anything's alarming, then I'll definitely, let you guys know. But I think they kind of, the light went off and they got it.
Yeah, and hopefully now after you're done with them, that the light stays on still.
Yes. Yeah.
I mean,
Yeah.
the problem is that, right? Out
Yeah.
of sight, out of
It's
mind.
keeping
type
it
of
on.
thing.
Yep.
Yeah, it's just that because that's the second time that they got called in, and we had to come down harder on them the second time in a matter of 6 months, and they did a phenomenal job in these 4 months, 5 months to get to where they are right now. So yeah, kudos to you and to the staff there for doing that. I just hope they stay on top of it now and not,
Yeah. I
let
agree.
it fall again. Otherwise, third time's not the charm.
No, no, definitely not. Definitely not.
Any other comments from Lisa or Teresa?
I have a question for Jason. There are many things in public health that I'd like to think I know about, but food safety is newer on my list. Say there's a repeat offense. Say this comes up in the fall again, or even next spring. What steps are taken? Do we continue along this path of, okay, you made the mistakes, we work with you?
Well, I mean,
is there any fine involved? Is there anything that really puts them in a place where we really don't want this to happen again because
right.
it's going to hurt us?
Well, the threat of closing them is going to hurt them. And if they keep repeating these, if they're so bad that they're going to cause people to get sick or even death, then they have to be closed. That a fine is above my pay grade. I don't know if that's a state thing or you guys kind of vote on that. Seeing my face walk in isn't always as pleasant, but I think there's great two examples. Casa Volata has learned, they've listened. When I'm there, they're engaged. And at Kumar's, they're just kind of like, oh yeah, we'll fix it, we'll get to it. So we have to try and switch that at Kumar's. So I think the education and the threat of closure, bringing me, they had to pay me and bringing me on, that's kind of like a big eye opener,
Okay.
in my opinion.
So there is some cost.
Yeah. Oh, yeah. I'm not
involved
doing
for
this out
that.
of the kindness of my heart.
Right. No.
Well, and then,
Yeah.
Lisa, regarding the cost, so our fee structure, I think, Edie, you can correct me if I'm wrong, it was last revised in 2008. Okay, our Board of Health fee schedule is on my pet project. I've already talked to our town administrator. And one thing I've done in other towns and that we see is that, a food inspection establishment permit carries a certain fee, but then you do additional reinspection fees. So if it's not a routine inspection, the first reinspection fee may be $100, a second reinspection fee may be $200, so I'm not, that would be a separate proposal and a process to work through, but that's where I've seen towns institute the fine. So if your health inspector has to go out every single week because they're constantly, nothing's addressed, right? It's staff time. That can be a disincentive and also help to cover those costs associated with your staff. So that's something the Board of Health could look at as we review the fee structure. So it's not to Jason's point, it's not in the Massachusetts Merged Food Code. There's no fining structure, but we as a municipality have the ability to set permit fees and inspection fees, and that's one way it can be done.
And I think to Jason's point too, Lisa, is that the threat of closing them down with frequent violations, same violations, maybe the first time it's 1 day, second time it's 2 days, next time it could be a week, right? That's a lot of money these restaurants are going to lose. I mean, that money is going to be more than enough to cover Jason and all the re-inspections. If you shut them down for a week or 2 weeks, if you pull somebody's liquor license for a few days, that's a huge,
Sure.
that's huge.
Yeah.
And we've done that. We've done that before. I mean, I can remember pulling somebody's liquor license for a week, and they're not happy about that, when they gave underage alcohol or whatever it was. So closing them down is probably the biggest thing you can do for them, to get their attention. Because all these, minuscule fees are getting Jason to come in and do his thing. It's small potatoes in the whole scheme of things. So that's the next step we would have to do if it happened again, believe me.
Yeah.
And it's not like we want to do that. That's the sad part. We don't
Right.
want to
No,
shut them down.
That's what I tell them. I said, you guys are here to help, ask questions, call. They're not the big bad monsters. You're just
Yeah.
not doing it right. And
Yeah.
you gotta stop. You're gonna kill somebody. I mean, I don't think they get that
Yeah.
sometimes. So
Well, I think that was where my question really came from, is the lack of understanding of the consequences. Are we not clear enough about if this, then that? Where's the algorithm of you've gone really close to the line of closure now? So, I mean, anyway, I think more things to talk about in months to come, and this was really helpful. So thank you.
oh, thank you.
Well, thank you so much, Jason, for joining and giving us clarification and updates on both of the restaurants. So we understand where we stand too with them.
Yeah.
And what needs to still be worked on with at least one of our restaurants.
Yep.
And hopefully within a week, we'll see some improvement further.
Yeah.
Based upon the recommendations that Kristen has just, listed for us. So
Great.
Great. Thank you.
All right. Thank you for your time.
Thank you.
All right. Bye-bye.
Okay, and I just want to check through the chair, Jim, we don't have any other hands raised at this point.
There's no other hands raised? No?
No, I do not see any hands at this time.
Okay. Thanks, Jim.
Thank you. So next on the agenda is just Greater Boroughs Partnership for Health updates.
Mhm.
So I'll be brief because we're already at 7 o'clock, but we were making great progress with Greater Boroughs Partnership for Health. Our nurses are still continuing to contact trace, as Isabella mentioned. We have our nurses also going out, and we're starting to pilot a new home wellness check program I might have mentioned to you for at-risk seniors who are referred through various sources. So this has really started off in Boylston. Our nurses are excited and out Salmon VNA is an additional per diem nurse, Nancy Favuli, who is starting to pick up the pace and being able to expand this through the region. So that program is in its infancy, but going well so far. So,
Good.
you know, if anyone, the public, or if you were to know any seniors that could just use a friendly visit from a nurse to maybe assess for safety or to see if they need assistance with, you know, medications, or we're just worried, we haven't seen them in a while, you know, all of this is voluntary. The phone number is shared, and our nurse or other town department would reach out, make the connection, and ask if that resident would appreciate a visit, you know. And so they're doing everything from checking for trip hazards to, you know, night lights in hallways to helping them with medication, you know, just organization, you know, do you have expired meds? How do you keep track? So we're looking to expand that. And we also have had Haley Parenti as our outreach coordinator. She was hired using Metro West Health Foundation funds. She's been helping us here at Town Hall with COVID testing of town employees, which has been a huge relief. So I'm not running up and down the stairs, and that's been helpful with this recent surge. But most excitedly, Haley's been distributing these essential protection kits. It's a really pretty canvas bag that's been going out to our residents. So we're really trying to deal with our diversity, equity, inclusion, helping our residents through affordable housing. We've offered bags to them, distributed through our food bank, the senior center, and we gave many bags out through Meals on Wheels. So these bags we're stuffing with KN95 masks, test kits, regular disposable mask, hand sanitizer, disinfecting wipes, and most importantly, just, you know, we're here, Greater Boroughs Partnership for Health. If you have questions about how to administer a home test, or don't know, you know, questions about isolation, quarantine treatment, any of those things, you really want to make sure those residents realize we are here as a partner. We're another source of community health. So that's an outreach program we're excited about, and those have all been distributed. We do have more supplies and bags available. If there's anybody in need in the community for those kind of supplies, we could work through youth and family schools, et cetera. So that's about it. I don't know, Isabella, am I missing any other updates on Greater Boroughs Partnership for Health?
I don't think so. Just that event. What day is it again?
Oh, right. So yeah, the Be Well event, is that what you're talking about? So that's a bigger town initiative, but we have our kickoff event. Lawn signs are going to start appearing around town in the next few weeks. So that is a kickoff event for this new interdepartmental effort to really make people aware of the resources we have in town. Everything from recreation to social services, you know, to health and safety. And so that's June 22nd. It's the last day of school. It's a half day. We'll be at Ellsworth McCaffrey, did I say that right? Park.
McAfee Park.
McAfee, sorry, on South Street. And so there'll be everything from demonstrations of hands-only CPR from your lovely local fire department to free giveaways for both kids. You'll see the pickleball court might be ready by then, you know, so if you're a pickleball player, so it'll be a nice time to come out and see some faces around town hall. The library will be present, you know, and giving out materials just to really engage the public. Everything to do with Northborough, get out of your house, let's get out of the COVID fog and see what local resources are available. So there is a new community calendar that has been launched called BeWellNorthborough.com. You can find it linked off the town's homepage, and we are slowly adding programming. We're starting with just our town programming, but the goal is we have a policy and calendar posting procedures. The idea is nonprofits or other groups that really are doing fun-free or programming, you know, if it's a concert through the different town committees or things like that, it would all be one calendar of just the fun stuff, you know, or just the free library programming or some of these Be Well sponsored events like yoga or trail hiking. So ways where we can really re-engage our residents of all different ages and finding it all on one calendar. The one thing in Northborough I found is everybody says, when is that concert on the don't we have a concert? Where do you find the dates? I couldn't find that. So hopefully it will be one calendar people can scroll through and we're making improvements to that. So more to come.
Good.
And I think that's it. So we're now on to
Positive.
agenda item 7. Any other business to come before the board? Okay.
Nope.
And then agenda item 8, approval of the April 12th, 2022 meeting minutes. Was everybody present for that meeting? Because we
Yeah.
might not have a quorum to vote it.
Yeah, we don't. Glenn was there. I think Swati was there. Yeah, everyone was there.
Okay, but we would have a quorum of the members present. Were all three of you present for that? Okay,
Yeah.
so we
But
could vote it.
well, no, we couldn't because the people who are absent, they can't vote, right? Glenn or
Well, they
Swati.
can't, but at least we have 3 of the 5 present. I don't know. Am I get that right, Teresa?
Did they, we can vote it, but if they had any changes, they wouldn't be incorporated. So it may be
Yeah.
wiser to just wait until they're back and do this month's and last month's at the next meeting.
Yeah.
Sounds good.
Yeah. Next month, only the 3 of us would be able to vote on that one anyway. So.
Right.
Okay. And then
Okay.
lastly, so we'll just continue that, Katie, to our next meeting, the approval of the meeting minutes. And then number 9, establish a tentative future meeting date. We have June 14th, 2022. It would be 6 PM. And we're planning by Zoom, I think, just because it's easier for everybody to make it, today only having 3. I know people are going to start traveling. So would you want to keep it as Zoom on the 14th?
Sounds good.
Sure.
I talked to Jason Pearl about this today to find out when we were coming out of Zoom and rejoining the living. And the order goes through a date in July. The Zoom order goes through a date in July. So, under that protocol, we can continue to do it that way. So
Okay.
I'm fine doing this one by Zoom.
So I take it then we're done. We make a motion to adjourn.
So moved.
All is in favor?
We're going to second that.
Oh, we got
I'll
a
get
second.
in
It.
trouble for such a simple motion. Second.
Lisa, you're gonna second it for
I'll
us?
second it.
Great. All those in favor, Teresa, Lisa,
Aye.
and I am for sure aye.
All right. I'm off to ground one.